It's the most wonderful and unwell time of the year.
Well, there's lots of viruses out there right now. A lot of that's the common cold, but you can't really tell the difference, or we can't, from COVID. So I encourage people to get a COVID test because the treatment is entirely different.
Rhinovirus is the main virus that causes the common cold, and its numbers are up across North Texas. So are cases of RSV,
which is a very common respiratory virus that for many people is kind of a nagging cold, but for older adults, people who have a weakened immune system, and infants, it can be much more complicated.
It's a horrible disease for kids, particularly under age 2, and the children's hospitals are full. I just looked up that, and they're full of these cases.
Last week, Children's Health saw 454 RSV cases and 512 rhinovirus cases. Cook Children's saw 324 RSV cases and 108 rhinovirus cases, along with 121 cases of mycoplasma pneumonia. All of them cause yucky respiratory symptoms. What are the steps you should take if you feel like you may have either?
Really kind of reevaluating whether or not you're going to be in contact with people who may have complications from that illness, covering your cough, lots of hand washing. If feasible, wear a mask.
And be aware of when to see your doctor.
If at any time your child has difficulties breathing, feels short of breath, is not eating and drinking, particularly drinking enough to maintain their hydration, then that's a reason to have them seen.
Dr. Sharma also mentioned that kids are with adults, so they're often getting the same illnesses. If you're still wondering about that COVID or flu vaccine, it can take a couple of weeks to get full protection. But Dr. Winter actually says flu season hasn't arrived yet, so there's still some time, Chris.
All right, that's really good to know. Thank you, Dia.